Thank you. Thanks everybody for sticking around today. So I'm going to be presenting part of a study that we're doing titled Wired Sex. One half of the study is looking at service providers' perceptions of GBSM drug use, and the other half, which we'll report on next year, is the actual users of those drugs. So our rationale for this study was really, we got to thinking about the ways that sex and technology is really influencing the ways that we interact. And within that space, we know that there's quite a bit of drug use in a whole range of styles. So that list that he had up there is a great example of the different types of substances that we included in the study, so it wasn't limited to any single type. We also know that the online venues are replacing a lot of in-person ways that people connect, particularly for sex. And so there's a serious challenge in delivering prevention and support within that space. So how does technology and sexualized drug use impact gay men's community? I think that's another important facet of this, is that it's not only, technology changing the way that we interact for sex, but how we think of ourselves as a community. So we did 50 interviews of guys who use different types of drugs at Halifax, Ottawa, and Vancouver, but I'll focus on the second part of that, service providers, and you can see a bunch of different places. And the other thing that I would say here is that the service providers are really dealing with guys that needed help in some ways, so you're going to see a lot of the issues that come forward are more problematic styles of drug use. But you also see that there's this tension that appears in the interviews. So what we did was conducted these interviews by phone. All of the other interviews were conducted in person. We auto-recorded them, thematic analysis, and our overall framework in our approach to this study is a post-structural and queer framework, which we can talk about if you want to know more about that. So we obviously know what GBMSM uses. We use the term social networking apps just to include all of the different venues through which guys connect. Sexualized drug use, we're using that term. We realize it doesn't capture everything, but Chemsex, P&P, and any other sort of relation, way that guys connect and use substances in their sexual relationships. So we had 4 main findings that we came up with that I'll explore now. So first of all, that's the substances and the apps and sex obviously are very much connected. It's quite unlikely, that if you log on to Grindr or any of the other sites that you're not going to come across some type of drug use in that space. So it's always there and it's always accessible is an interesting thing. The different apps, are for different purposes for a lot of people. The people will go into certain apps when they're looking for, different types of sex or harder drug use and so on. And it's a way that sexualized drug use can be initiated. We know that a lot of connections are made through that space. And what we also are hearing is a lot of language and codes that emerge, and that's partly because the apps limit what you can say because they don't want drug use to be there, which adds to the stigma, and then it creates a whole other set of coded languages and drives things underground. And as we know, the more that we drive things underground, whether it's drug use, HIV, all of these things just adds to the stigma and adds to the complications around doing health promotion. And then there's always the negotiation of sexualized drug use within that space and how it will happen. So one of the service providers said, it isn't just about the hardcore party and play. Some people might identify that way, but if you ask people if they used a bit of Coke or a glass of wine, I think that sexualized drug use is quite ubiquitous for most people. And another one was talking about when they go online, they're also managing and coping with a lot of other institutionalized forces that pathologize them. They're navigating criminalization, hidden languages, cryptic messages, so all of this stuff gets really complicated, particularly because the apps and what people say in them are hidden from public view. And so that was one of the challenges we sort of had with this study at the outset, is that we wanted to get into that space, but as of yet, we haven't really figured out a good way to get what guys are really saying in their messages back and forth, and then entering that into academic literature. So if anybody has any ideas about that, come see me after. So I'm not going to go through all of these, but we have a number of these lists, and I wanted to put them in there that, people use drugs to drop inhibitions. I think everybody knows that. Sexual pleasure, also to deal with isolation, loneliness, improving focus. And the body, I think, emerged over and over again in our research as a main point of contention, that people's comfort with their bodies, the type of body shapes that they see online influences their perceptions, and so on. Yeah. The benefits. So this isn't to say that all drug use is bad, right? We know that it's not. It's actually provided, a lot of access, particularly for queer men over the years, to spaces and the types of sex that they want. It can certainly give a sense of freedom, and a lot of these will overlap, right? Exploration, euphoria, senses of invincibility, and just basic pleasure. I think that that's often something that gets overlooked in our discussion of it. There's a reason that we do these things, right? Like, there's a lot of pleasure that can be had within the sexualized drug use environment. Yeah. And I think also one of the things with the apps is it makes it easier to meet up with other guys. It isn't always easy when you have an anonymous connection that's going to happen one time, and drugs can often facilitate some of the tensions that arise around that. And so another service provider comment, this is people self-medicating, and it's not necessarily a bad thing, depending on to what degree they use it as a crutch. But it's also, and I think this was something that really stood out to me, that it's a community under stress. The homophobia that comes out is a really important aspect of this. And a collection of individuals under stress, and they're finding ways to relieve that stress in an environment that they view as safe. And sometimes the drugs give them access to that safety. So the types of coping mechanisms that we saw emerge: lacking of self-acceptance, self-esteem, general crises, the trauma, death of loved ones, moving to a new city, and the isolation and loneliness came up over and over again, which I think is another important feature to the apps, that while we can constantly be connected to other people, we're also finding out that it also contributes to a great deal of loneliness, despite that connection that's happening online. Dealing with rejection, basic boredom, again, body shame came up, and then coping with HIV diagnoses, and a whole bunch of other ones. And by the way, if you want any of this information, in the next month or so, we're going to have our community report on the service providers ready to go out, so you can drop me an email, or hopefully we'll get a website up soon. So another service provider said, even something as simple as a guy really wanting the bottom, again, getting access into the types of sexual practices that people might want to have, drugs give them that. Inhibitions are gone. Fisting often came up as one of those things that people were thinking about that they desired but weren't able to necessarily access without some sort of substance. So again, back to the enhancing sexual pleasure and drive, able to lose control, being free, the intensity, piggy, kinky, raunchy types of sex. All of these things seem to be very tied in together with the apps. And just giving access to the type of superstar sex that people want to have. And obviously related more to the heavier drug use and crystal meth, being able to sustain sex for 2 to 3 days. Yeah. So reducing anxieties, the nervousness around meeting up with people, feeling unattractive, and you see there's a lot of common themes that ran through the questioning that we did. Social anxiety, and then fears around HIV. So speaking about meth, one of the guys said a lot of guys are using meth as a community almost. We call it the intimacy paradox, where it gives the illusion that you're part of a group, that you're part of a gang that actually likes you, whereas we know that crystal meth actually prevents your brain from feeling empathy, so there's this idea that I'm less rejected when using crystal meth. So I think that this one can kind of go both ways. I certainly have known a number of people that have garnered a community around crystal meth, but at the same time, we know that some of it, isn't real, which then often leads them to question after the authenticity of that interaction itself. So one of the tensions our service providers noted was around, on the one hand, seeing the positive benefits, the joys, the liberation that can come from accessing the type of sex that we want, whereas the problematic things that result from syndemic effects around homophobia, transphobia, and other problems with body image and so on. And I'm not going to go through all of these, but, problematic substance use, we know there's a whole list of reasons out there and things that are associated with that. Send that to you if you want all of them. So the other one that really came up frequently was this paradox of consent and boundaries becomes very complex in the context of both apps and substance use. So like being high on crystal meth means to not have boundaries, but when they're sober, they might think that sometimes they freak out because they're high, and then they wonder about that authenticity. Was it the real me who identifies the top, or the real me that the person gets fucked by 8 different guys on a Saturday night? And there's a lot of this internalized stigma that goes with it. Did I really enjoy fisting, or was that just the drugs? So there's this paradox that happens within a lot of people's mind, particularly when using crystal. So again, we see that sort of tension come up about being able to have frank conversations about boundaries and desires, but people may not want to follow through with the things that they discussed online prior to. I think apps are an interesting way to negotiate consent, but consent isn't once and forever, right? Just because you say you might be interested in doing something online, when you show up, it may not actually turn out that way. So the last really slide here for what we're saying around our implications for service providers is that we need to build capacity in culturally competent services and coordinated responses. I think that in some of the bigger cities where the issue is much more obvious around what we can do to help people, when we get into places like Halifax, smaller cities, Ottawa is doing a great job with their Spill the Tea program, but there isn't often that space for dialogue and coordination of what we say, and not using just abstinence-only type of responses. Relying on those insiders' knowledge and biases that we have. We as a community know what's going on, and it's important that we don't stigmatize that, and that that we keep it hidden within those spaces. And I think the more that we can destigmatize it and acknowledge not only what we do, but why we do it, that it can be helpful for the community. Stimulating conversations and initiating critical reflection, I think that was a really interesting thing that we'll see hopefully next year whenever we're presenting on the 50 interviews. There was a lot of thinking that people do about their drug use. It's not always this common perception that people are just out of control and going off the rails. I think that if you talk to most guys who use different types of drugs and carry on with their lives, they're very deliberate in many senses in what and how they use. Reducing harm, obviously, providing information education, and just learning from others. I think it's an important thing. I think this is a great space here at the forum or at the summit where we can have these dialogues and learn about the different things that are happening. As we saw in the session earlier, leveraging technology and hopefully getting some of the apps a little bit more into health promotion. And then the last one, and I think this is important, is to be able to have real and frank conversations about consent. There were very few, even anecdotal or in the actual interviews, discussions where I had with the guys where consent was always clear. And I think that it's just not. And how to best negotiate consent, and particularly when we're under the influence of various substances, is an important thing. So, yeah. So again, not wanting the last tension, not wanting to be judgmental or pathologize, while at the same time interacting with clients and community members who experience the harms. I think, we don't want to pathologize, we don't want to say that we're not doing it, but on the other hand, we have to recognize some of the negative outcomes from drug use. So the next steps, we're obviously going to be analyzing the data from the other half of our study, and then we'll have a bunch of KTE tools to get out there and disseminate our findings. So this is who I am, CIHR. Thanks for funding us, and thanks to San Patton, Marc-Andre LeBlanc, Chad Sino, all members of the research team who contributed to this. So great. Thank you.